Hello, I am Karen Elizabeth, Patton Jack's baby girl, and welcome to Karen's Inquisitive Corner. September actually celebrates a lot. They celebrate is probably not a good word, awareness of childhood obesity, childhood cancer. And one other thing is self care. This is something that we all lack. Sometimes is taking care of ourselves first. So, in the corner for the month of September, we're going to focus on self care, not just your normal self care with like eating or making sure you exercise. We went through all of that in the corner before, but we're going to deep dive in some areas that you may think are familiar. For example, today we're going to talk with Anna Olivier, and she is a nurse. She also specializes in midlife kind of menopause crisis for women and for men. So she's going to come on today in just a minute and talk to us. But I want you all to definitely like and share, especially this month in September, because we're really going to be giving out a lot of information on self-care. Please don't look at the title and say, oh, I know about that, because this session today is going to be way beyond the night sweats and the increased anxiety or maybe the little weight gain in a menopause. So let's bring Anna on right now. Hey, Anna. How are
Hi.
you? Welcome to Karen's Inquisitive Corner.
Thanks for having me. This is going to be a lot of fun. I'm looking forward to this discussion.
Awesome. Your page kind of freezes a little bit, but that's okay. We can hear you loud and clear, so you're good.
Good,
So
good.
I was just telling the audience, excuse me. I was just telling the audience that September is self-care month. And so we're going to talk about menopause today for men and women. And we're going to go a little deeper than just, the regular normal night sweats and maybe gaining a little weight, maybe a little anxiety or so forth. So I want to dive right in because there's one thing that I've been thinking about since we talked. So with menopause, we all think about like night sweats, maybe a little increase of anxiety, or maybe I've also heard of people kind of, not wanting to be in elevators or not wanting to be in stairwells or those type things. When we talked the other day, you mentioned, Anna, that there were like approximately 60 signs and symptoms that may indicate that you're going through menopause. I could not wait until we filmed this because I wanted to know what are some of the things that may fall under that umbrella where we may be in a menopausal state but not really realize it.
Sure. So when you think about our hormones, our sex hormones do more than just help us with reproduction and procreation. Our hormones are essentially signaling molecules that interact with all of our body systems. So if you think that hormones are changing as we get to midlife, whether you're male or female, with females, it's a lot more erratic and more noticeable. With males, it's a gradual change. But when you think about the fact that all of these hormones are connected to bone, muscle, immune system, your brain, your heart,
Yes.
your digestive system. So you can just imagine why there are so many symptoms that some people may experience a handful. Some people may only experience one or two. Some people may experience several. And because these symptoms look like other disease processes, they're often misdiagnosed or missed or brushed off as just part of normal aging. So it's important that you become a little more self-aware, pay attention to the messages that your body is giving you, and understand that it's a transition in life, but often these symptoms can be troubling. So just because your doctor says it's common doesn't necessarily mean it's normal, and suffering is optional. So often we are told to just bear with it. It's just part of aging. We're going to our skin changes, our muscle tone changes, become, like you said, anxious, hot flashes. Men can also experience that temperature fluctuation. They can experience energy changes. They can have some changes as well that they're going to notice physically. So yes, we can expect that our body is going to change and not be as vital and strong and resilient as we were when we were very young. And that's just a normal part of aging, yes, but we also need to be aware that some of these changes are troublesome. Some of these changes could mimic other things that we need to talk to your doctor and have it checked so that you can rule out, is it another disease process that is more serious than just the change of life? And should we be getting diagnosed and treated or preventive care? So it's important to listen to your body and not be afraid to report things to your doctor, because only you know how you're feeling, and being able to express that and be your own advocate to make sure that you're getting the care that you need is really important, especially in midlife, because things start to change.
Awesome. So could you give us maybe some definite signs and symptoms that we may not have heard that may fall under the umbrella of menopause?
Sure.
Maybe some of the things that we would really be shocked to think, oh my goodness, I didn't know that.
Sure. So some of the milder ones you might notice, dry eyes, dry skin. Myself, for instance, my eyes would get so dry at work, and I would get so irritated they would burn, and then I'd start to cry. People think I was crying on purpose, but my eyes would just water like crazy, and it was driving me nuts.
Hmm.
And a lot of people have experienced this in midlife. They start to get dry eyes. You need those artificial tears. So that is a common symptom that people don't often connect to the changes in our hormone level. So it can also affect our skin. Your skin's not able to produce as much lubrication, or the inverse, you can also start developing acne, where, when you're younger and those hormones start to change, we tend to get acne. And then the same can happen as we're transitioning out of our reproductive age. We can also start to get acne. So that's something. Something that can be a little more scary for people, and these symptoms, like, again, they should always be checked out with your doctor. Just because I say it's a symptom that can happen with the change of life, we want to make sure that we're not just disregarding it, that you should pay attention and report to your doctor. So electric shocks in your hands and feet, sudden like burning, tingling, or electric shocks. And they're not quite sure why this is related, but there are signals in our brain. Your hypothalamus talks to your other endocrine system. It talks to your nervous system. So there's something that's being disrupted or short-circuited that it can be very disturbing. And people often wonder, what's going on? This is really an unusual symptom. So please check that out at your doctor to rule out it's not anything else. But that is a common thing that they see with people going through the change. Another thing would be like a burning. It's called burning mouth syndrome. So you get burning mouth, burning gums, very irritated feeling. And sometimes it could be a medication that can trigger that kind of feeling, but sometimes it's the change in hormones and the fluctuation of hormones that can cause. It's a really annoying symptom. I have a client that experienced that, and she had gone to all sorts of specialists. She started complaining to her dentist first. Then she thought maybe it was medication related. She went to her doctor. They switched up medication, did some testing. And then the more that they researched together, both her and her doctor, they discovered that this is something that can happen. And eventually it resolved. It felt much better. She would try chewing minty gum. So even though her mouth was burning, having that cool mintiness seemed to help relax that. For other people, they find it more irritating to your gums and your teeth. So that's something. Dizziness. So dizziness, as you think, it can be related to, we often get palpitations in our chest as our hormones fluctuate and change. That can cause dizziness, or also we may not even have palpitations and we get dizziness. It could be caused from our blood sugar changing and being more fluctuating as our hormones fluctuate. So that's something, again, it's a concerning symptom to be dizzy. You want to get your blood sugar You want to get your heart checked, but everything else could be ruled out as normal, and it could be something that is because of your hormonal changes.
Oh,
Um,
wow.
yeah, other things when you think, affects all body symptoms, you can start getting water retention and bloating. So you may get swollen ankles. Again, that's a concerning symptom. We want to make sure everything's okay with our heart, everything's okay with our kidneys, but that can all be ruled out. Everything seems to be normal. It could be hormonal related. So it's just when you just consider every single body system,
Mhm.
it interacts with our hormones,
It's
you're going
affected.
to get a reaction in every part of the body potentially. So those are some of the unusual ones, but that can also happen. As a massage therapist, I get a lot of women who, once they get into their 40s and 50s, they say, I'm just falling apart. I must be getting old. I have frozen shoulder. I have bursitis in my hips. I have tendonitis in my glutes. Doctors just send me to physical therapy. I'm on steroids. I'm on anti-inflammatories. That again is, as our estrogen changes, estrogen is actually a very strong anti-inflammatory in our body. So when we no longer have the levels of estrogen our body was used to, we can be prone to inflammation just from the
Yeah.
wear and tear, from our diet. And so we don't often recognize that that's a signal that we're starting to go through the change. I have one of my clients is 37, and I see her quite frequently for shoulder and hip issues and pain, and the doctors aren't sure why. And I said, maybe you're perimenopausal, because that can start to happen for women around 35 to 37. And then it can, perimenopause can last for 15 years. So doing things to beware and to help promote mobility, strength training, an anti-inflammatory type of diet, herbs and things like that can really help ease the symptoms and then make you more aware to start paying attention to your body.
So when you just gave us an age range, that was going to be my next question. So you referred to as perimenopausal. So well, actually, I have a couple of questions, but the first question is for women and men, what age range is that kind of midlife?
So for women, about 35, 37, things will start to change. You may not
Early.
ovulate each cycle. You'll still have a normal cycle, but you may not be ovulating. It may be a couple days longer or shorter. Things
Mhm.
just start to subtly change. By the time you're into your mid 40s, you're much more aware of the changes that are happening to your body. And usually by the time women are 48 to 52, for most women, that's when you're declared to be menopausal. So you shift from the perimenopause is a long
Mhm.
roller coaster of estrogens up, estrogens down, estrogens up, and then your progesterone is a gradual downhill slide. Your menopause is declared to be officially menopausal 1 year after your last menstrual cycle. Then boom, suddenly
Sometimes
one
women get
day,
caught up with that because they think that they hadn't had a period in like 10 months, or
Mhm.
they had maybe just a day period. And so they get caught up and think that, okay, I'm in menopause, I can't get pregnant. And that's kind of when, the surprise baby shows up because you weren't
Yes.
fully in menopause. So is that the same age for men also, around that 35, 37 age?
Yeah. So usually for men between 30 and 40, they start to slowly, it's only, for the first couple decades of going through andropause, it's called for males,
And
they're losing about 1%, 1 to 2% of their testosterone levels. So it's a very slow and subtle thing. A lot of it depends on lifestyle and diet, how much you work out, toxins, that kind of thing. You can have a sharper decline. And then once you get ages 50 to 60, then the decline starts to go a little bit faster. But for men, it's more like a gradual hill that you're going down for production of your hormones. And
sure,
for women, it's very perimenopause is very up and down. That's why you get those hot flashes and
just moody, just up and
bloating. It's
down
the
moody.
mood, it's
Mhm.
a very rough transition for us and also for our partners that have to live with us. So um having men aware of what women are going through, that it's not something that we don't suddenly become irritable and sweaty and angry and heavier. It's just something that happens to us. We have to endure. And it's really good if your partner is on board and understands that it's something you're working through and that he can be supportive, hopefully.
Let's go back to the men, and what is it called? Anthropause?
Andropause. Yep.
Andropause. So with the men, you talked about all the things that we can go through. Do they also experience that, or is it just with their testosterone that they have like decreased hormone? We know they have the decreased hormone, but how does it affect them? Can they still go through some of the things that we go through as women?
Definitely. As hormonal levels drop, testosterone is it's a hormone. If you think of, men, it's a hormone of power. So women also have testosterone and we need it. It's good for brain health. It's good for mood. So men who are low in testosterone or have a decline in testosterone are more likely to experience depression. You start to notice an inability to recover or longer to recover after physical activity, workout, and sports. Difficulty building up muscle mass as they get older. So when you're young, it's really easy to work out and you start to bulk up. And as you get older, it's a lot more work involved and it's really harder to bulk up. Also, it can affect their sleep. They may start to experience some weight gain because as the testosterone goes down, men also have estrogen in their bodies too. They may notice some weight gain. So the fat is now taking over areas where they used to have muscle. They may start noticing, weight gain around the middle, just like women have. So there are definite changes that they experience physically, more aches and pains. So there's a lot of things that testosterone does for both men and women to help us feel resilient, strong, confident. It's a very important hormone for both of us.
Exactly. And I want to also go back, you just said in the middle. So you identified the other night we were talking that the weight gain for men and women is usually in the middle. And this is usually the hardest weight to lose when you're trying to lose weight. You lose weight everywhere else, but you're still going to have, that little tummy. But I'm so glad that you brought out that men can also go through this midlife, because a lot of times it may all be put on the woman, with our moods and with our transitions and so forth, but it can be both, and if it's happening at the same age,
Oh,
then
no.
you both could be going through something, your wife
Yeah.
and your husband, or you and your partner both could be going through something at the same time. But I also
Yeah.
liked what you said, pay attention to your body. If any little thing is different, pay attention to your body. And so we'll also read where, as women, sometimes men will say, or I have read in different places, I'm a nurse, so I know it's not true, but women don't want to have sex anymore, when they're going through menopause, they don't have that desire anymore, which is not always true. I know it may fluctuate a little bit, you may have some dryness and so forth, but that is not true. And I know that that's a myth that I want you to clear up for me, Anna.
Well, it is a lot. I mean, it's your libido has a lot to do with your stress factor, your energy level, your nutrition, your pelvic health. If you have some dryness, that you could have pain, so then you're not interested.
Yes.
You're at midlife, and so you're at the peak of your career. Your kids are grown and you're launching them, but your parents are aging. So you have a lot of things going on that can distract you from interest in that part of your life. And there is a change in your testosterone levels. So as women and men, testosterone encourages that activity. Testosterone is very promoting of the connection of romance and procreation, and our testosterone levels also trigger that in women as well as men. So as the testosterone drops and our estrogen changes and we're hot and we're sweaty and we're irritable, It definitely is off-putting. We're just not in the
Yes,
mood, but it
yes.
doesn't mean that that part of your life is over forever.
Mhm.
It's definitely something you have to be a little more aware of, maybe do a
Yes,
little more planning, make sure the room temperature is comfortable for you. Make sure that you're well rested and well nourished. Make sure that you're using appropriate lubrication if you need that, because it's an important part of a relationship. It's something that you don't want to give up. We're not, just
sure.
because we're in life, it doesn't mean that's all over for us. So
Exactly,
you
exactly.
can
For men and,
continue to
for
have,
men and women. So I'm glad that you
yeah,
really brought that out for
yeah,
men and women. So let me ask you something as we kind of come to a close in about 10 minutes. So I take a hormone because I had a hysterectomy, a total hysterectomy. I mean, I don't have ovaries, I don't have anything over 30 years ago. I know it's been a very, very long time. So I take hormones every day. And if I have not taken my hormone for a week, I know it. And if you're around me, you're going to know it. But there are some people that have had hysterectomies and total hysterectomies, and they don't take hormone replacement. So we always say in the corner that what works for you may not work for somebody else. Some of the things that you're going through, another person may not go through. So just talk a little bit about how, or maybe why, hormones work for me. They may not work for somebody else, or somebody else may not even need them.
right. So as we go through the change, so even though if you've had your ovaries removed or you're going through menopause and you're menopausal, your body still can produce a baseline of some estrogens and testosterone in other tissues. So your adrenal glands, for example, that sit on top of your kidneys can produce some hormones for you. And your fat cells also can produce some hormones for you. So you're not going totally without.
Fat cells, did you hear that, y'all? Fat
Yeah,
cells. We want to
fat
keep some
cells.
of those fat cells. Okay.
It's okay to get a little bit, we don't overdo it, but your body has some wisdom. It knows when those hormones are no longer in your bloodstream, it
Yeah.
starts to realize, okay, my adrenal glands need to start producing some hormones, and I need to have some more fat cells to start producing some of those hormones. It's not going to be at the full level we are in our reproductive age, but it's definitely a level that helps us to have decent mood, decent sleep, help us manage pain. So it's a nice little baseline level that we should have. So each person is different because you could have a higher stress level. You could have insulin resistance. I mean, there's a lot of other hormones that
Yeah.
go into play. Your hormones affect your thyroid. So if you have thyroid changes because of your hormone, you could develop Hashimoto's or autoimmune against your thyroid
Mhm.
and have low thyroid. So you're going to have a lot of the same symptoms that are like fatigue and temperature changes and weight gain. And those are all related to, your thyroid. All the hormones are connected.
Mhm.
So each person is so different in how their body tissues are at their baseline, what other things are interfering with the production of our other sex hormones that we're trying to make up for. Um, our diet, our toxins in the environment. There's a lot of artificial chemicals that we're exposed to all the time that are endocrine disruptors. Endocrine disruptor means it interferes with our body's ability to make and use our own hormones. These chemical compounds are very similar chemically to the hormones that we make in our body. So our body gets confused and accepts those artificial hormones onto the receptor sites of the cell and can start to cause bad symptoms, make us ill. So times are changing. We're bombarded with a lot of stress.
Yes.
With we're caregivers, we're in the middle, we're taking care of parents, we're launching our children, we're still peaking our career. There's a lot of stressors, so everybody's going to react differently to changes in life, and that's why it's really important to be aware of what is your normal, what are you comfortable with, what symptoms are troublesome, and what do you want to talk
Yes.
to your doctor about.
Exactly. And although my hormone is actually prescribed, I know a lot of people may take a holistic approach or maybe a natural hormone that really, really helps them out. But, if you're going to do that, always check with your doctor. You always want to, run it by your doctor. So, in talking with your doctor, let's talk just a little bit about what we should present to our doctors that we would like to have, because sometimes we may say, I'm saying this very nicely, nurse. Sometimes we may say, this, that, and the other, but they're not. The first thing that they're not always going to do, as you and I know, is take your blood to look at your hormone level. They're just kind of going by, maybe some of the signs and symptoms before they really, really get into that blood test. So just tell us a few things if we are having any of these signs or symptoms. When we go to our doctor, what are some of the things that we should ask for so we can have a definite diagnosis of what's going on? It's nothing more frustrating than to go to the doctor and he says, well, it's probably this, or it's probably that, or it's probably this, or it's probably that. We want to know, am I going through menopause? Well, you probably are. You've got all the signs and symptoms. What tests can you do to identify, yes, I'm going into menopause?
So the issue with testing, first of all, insurance, and then because our hormones can fluctuate so much from day to day, getting that blood test at that moment in time may not give us an overall picture of what's going on. So it's really not necessarily an accurate way to diagnose what's going on with your hormones at the time. So there are some alternative testing that some more functional medicine providers look at, called a Dutch test, which is a dried urine test. And again, there's a lot of controversy of how accurate is it? Is it truly effective? And also, is it really necessary? I think more so it's more important to go in with your symptoms so that your doctor can rule out, because menopausal symptoms can also mimic other symptoms. Like I said, low thyroid hormone or diabetes or heart palpitations could be a different problem, not related to your hormones. So I think the most important thing, discussion with your doctor, is to know the troublesome symptoms so that they can test to rule out other things. Those tests are easier to do. They're easier to get reimbursed by insurance. And these things are, as they test and say, your thyroid's good, your hemoglobin A1C testing for diabetes, that looks good. Like they're ruling out, and then
ruling out other things.
Yes, and what's left over, then they'll look at and then add it to, have a discussion, add it to all the other symptoms, your age, talking about your family history, when did your mom go through menopause, and that's generally how they come up with their diagnosis. And this is probably perimenopause. Nothing to be concerned about. If it's troublesome, that's when you can start to talk to your doctor. Do you want to start hormone replacement therapy? Because these symptoms, you're not sleeping, you're irritable, you can't function at work. These are really concerning symptoms that your doctor shouldn't brush off as, you're just going through the change, don't worry about it, because it's affecting your job, it's affecting your relationships, and not sleeping and being irritable.
It's affecting you,
It's affecting your quality of life. So that's why I say suffering is optional. There are a lot of natural and lifestyle things we can do to ease those symptoms. And there's a lot of things that they can do on the pharmaceutical side with bioidentical hormones that you can talk to. Some doctors are not likely to prescribe, so just shop around and ask questions. Do some research. There are some good resources. One of them, a resource that I suggest, is the North American Menopause Society. And it's a website that shows you where the providers are in your area that are specifically trained in hormone replacement and managing hormonal symptoms. It also has really good information for just the average person as a patient that you can go through and just read up and help to understand a little bit what's going on in your body, what you should be concerned about, and what is probably normal. So just to put your mind at ease.
That's a great site. Now, men and women can go to that site, correct?
Well, it's good for men to be aware of what's going on in women in their lives. But generally, a male should probably talk to their provider, because the North American Menopause Society is more geared towards women's health. For men, they want to talk to their doctor if they feel that their symptoms are troublesome. And again, to rule out, is it something else that needs to be addressed? Generally, for women, doctors are now more willing to talk about hormone replacement therapy. For men, not necessarily. It has to be really low enough to have some concerning symptoms. I'm going to have a little sip of water.
Well, get you a sip of water. I have one question. Then we're going to close. Did you say a dry urine test, or did you just say a urine test?
It's hold on.
Okay.
I'm getting dry from talking. It's a dried urine test, so it's called Dutch test. You can get it from different labs, but it's not generally covered by insurance. It's not generally recognized by mainstream medicine. It's more of an alternative medicine.
Okay. Okay. Well, Anna, you have given us so much information today, so much information. And as we close, I always close Karen's Inquisitive Corner with what I know that I know that I know. You have a lot of knowledge and information about a lot of things. So I'm going to let you close. But while we close, you guys, thank y'all so much for joining. But I do want to say, and just to comment a little bit on what Anna said. If you're in a relationship and you are feeling any of these signs and symptoms that she talked about, or just not feeling yourself, man or female, talk to your partners about it. Don't let it just go and go and go. Mm-hmm. And, come to find out, all you had to do was take a hormone, or all you had to do is maybe take an herb or something, or do something holistically, or whatever was going to work for you. Men, we know, I think they say men are from Venus and we're from Mars. I did a show on how different we actually are and how we're made up differently. And a lot of time as men, you all will just kind of look over things, or maybe not really address what's really going on, but do that. It could just be a simple pill, or it could just be a simple a hormone. It could be something very, very, very simple that we let, build up. So Anna, I'm going to let you share with Karen's Inquisitive Corner family what you know that you know that you know. Now, it can be about what we've talked about today, menopause, and thank you so much for being on the show, or it could be about something totally different.
I know what I know what I know. I know that we only have this one life. We have this one body, and that we're here to learn and to love and to laugh and to do the best that we can. So take care of yourself. And if you can take good care of yourself, you're a better partner, you're a better parent, you're a better child. It's just very, very important to just connect with yourself, take care of yourself. You just have this one life, make the best you can of it.
Awesome. Thank you so much for joining. Okay, family, I will see you all next Saturday. And I actually may have some pop-up shows this month on self-care, because I have so much information that I want to share with you all. If it's something that you all want to hear this month, please let me know. Please like and share. Mwah! I'll see you next Saturday. Bye-bye.
Bye.